Hi, I'm Ravi Dahiya. I'm a facial plastic surgeon. I've been in the DC metro area for about 10 to 12 years. I want to talk about a few topics today. The first of which is really one of my core specialties, which is facial rejuvenation. It's one of the things that I do most commonly and have really focused on. And I think a lot about it. Over the years, I've really tried to understand how people age, how faces age, and that's allowed me to really better address those components of aging. Three-dimensional rejuvenation, and that really refers to essentially the three layers in which our faces age. And we'll talk about it kind of going from the outside in. The first thing that most of us are aware of is how our skin ages. We produce less collagen, less elastin. The sun damages our skin, so what do we see? We see wrinkles and fine lines, brown spots, red spots. So that's that sort of outer layer that's demonstrating some of the aging that's most evident to other people. The next layer is a little bit less perceived and understood, but that's a loss of volume or fullness. Youthful faces have a lot of fullness, especially kind of in the cheek area. So that's one of the first places that we lose volume, is again that area we call the midface, below the eyes and in the cheeks or the nasolabial folds. So that's another area that we see lots of signs of aging. And then the last layer is a deeper layer. This is sort of the supportive layer. This is what we call the SMAS fascia, which is a strong fibrous layer of tissue. And then in the neck, there's a muscle called the platysma muscle. Those things droop. That's what gives us jowling or banding in the neck. So when I think of rejuvenating a face, I really want to address all three layers, not just one. The old-fashioned way, kind of traditional way, was just to pull on that connective layer of tissue really, really tight. So a person certainly looked tighter, but not necessarily younger. And we want people to look younger and vibrant. So the key is to address all three layers. So certainly doing a lift, which can tighten the platysma muscle, which can tighten the jowls, is a key part of rejuvenation. But we also have to address those other two layers. We've got to add volume, that youthful fullness back to the face. So that's where we can take things like Radiesse or Juvederm, or sometimes we'll take fat from a person's belly or thigh and use that to fill in those areas, like in the cheeks, nasolabial folds that have lost volume. That, again, that youthful fullness is really an important part of making a person look younger again. Then lastly, we do address the skin as well. That can include things like laser treatments or microneedling or chemical peels. All of those things can take away brown spots, red spots from sun damage, make our skin look smoother and tighter like when we were younger. So that's just really the most comprehensive way to make a person look younger. So that's what I call three-dimensional rejuvenation. I think that's what really gives the best results for a person looking to look a bit younger and fresher.